kung titignan mo, sa totoo lang ho, mas mahal pa kayo kaysa sa HMO na binabayaran namin. And when you compare it with the service that we're getting, hindi naman ganun ka, kung sabihin na lang natin, hindi equal, hindi comparable dun sa service na nakukuha natin. And I'd like to really factor into the fact na hindi tayo nag-increase ng case rates. Kasi kung responsive ang case rates natin, by now, our reimbursements, our spending should have been comparable somehow. Would you agree?
Yes, Mr. Chairperson, Honorable Representative Asidre.
Ito tinutumbok ko lang talaga kasi iniintindi ko because we had a global health emergency in the last 2019, 2020, 2021. And I think President Marcos lifted it later part of 2022, no? Especially during the pandemic. Am I correct, Mr. Ledesma, Mr. Chair, kanina when you mentioned PhilHealth had 6 presidents during the entire 6 years of the Duterte administration?
Mr. Chair, if I can add 2 things, no? Yes, you are right. If you even step back further, if I'm not mistaken, if you look at the administrations of President Noy, President Aquino, and President Duterte, that's a total of 12 years. If I'm not mistaken, in those 12 years, there were 11 PCOs in PhilHealth. So not 6 in 6 years, it's 11 in 12 years po.
Has there been any, study or assessment done how this impacted the quality of leadership? Kasi kung ako tatanungin mo, considering that PhilHealth operates as a GOCC, and normally, GOCCs operate on the basis of performance, kasi hindi naman kayo elected officials, or at least hindi rin kayo appointed ng political appointee, so to speak, no? Although you're appointed by the president, the chairman is, but as an institution, as a financial institution, we expect a higher level of efficiency sana. Would you agree that shift in presidents, yung turnover, yung parang practically revolving door ng mga presidents ng PhilHealth resulted in a breakdown of leadership, especially in the last couple of years?
Without a doubt, Your Honor, I think not just in PhilHealth, not just in any GOCC, if you have a corporation that's trying to promote or trying to move forward, and every year you're changing the president or the head of the corporation, clearly may apektado yan, tsaka talagang may breakdown po yun, no? So, to answer your question, yes, Your Honor.
Kasi kung titignan mo, ang mga problema talaga ng PhilHealth, I would even put the funding later at the end part. Kasi premiums are required naman, are obligatory naman. We have to pay. Wala naman kaming choice doon eh. They are automatically deducted. And Congress, for the last couple of years, has been very generous naman in extending the subsidies you requested. But look at the problems that PhilHealth had in the last couple of years. Efficiencies, disallowances. I-mention ko kanina, late reimbursement, mga hospitals ay re-reklamo. Yung digitalization, nakita yung interface ng, kahit yung interface ng portal natin, medyo in our time siguro much is to be desired. I just saw the COA report. There is 1.3 million deficient data that refers to incomplete or erroneous entries. And that's 15% of the total membership. If you're talking 1.3 million, at least of the paying, di ba? So we have around 8 million, tama ba? Paying contributors, direct contributors. And then there's even the mention na identify na siya noong 2020, duplication and multiple entries. But still, the problems were found to be there by 2023, and that involves around 266,000 senior citizens. If you count the number of years that they've been there, that would have amounted to 1.33 billion already. So clearly, this is not a question of there's a lack of funding. Maybe what PhilHealth should do, and I think that's the reason why the bicameral committee considered it, or I'd like to stress in the version of the House, we did not, unlike the senior vice chair who's here, no, confirm that we did not remove your subsidy. It's a BICAM decision. I don't know if it appeared in the Senate, but nonetheless, we stand by the wisdom of the bicameral committee that PhilHealth really needs a lot of house cleaning to do. We need to put the house in order because every time we put funding to this system, I don't know if you'll agree with me, Mr. Ledesma, that we will end up really like, it's like a bottomless pit. And despite your good efforts, and we've seen that, you've made mention of that, any infusion will only serve to exacerbate the inefficiency because it will only magnify the gaps that we are already seeing. And, you know, it's COA who's saying that, it's not Congress who's saying that. So I think to end lang, no, Mr. Ledesma, Sir Pres Randy, how can you enlighten, can you at least give the committee assurance? Kasi na-mention mo na kanina in regards to funding, no? But in terms of operational efficiency, are there any interventions that PhilHealth is thinking moving forward from this point onwards?
Thank you, Mr. Chair. Thank you, Kong Jude, Mr. Chair. Yes, we hear you. Again, we hear you loud and clear. Everything you mentioned is true. It's correct. We are not giving any excuses. We have to fix our house in order. We are currently doing a major reorganization, Your Honors. And this will increase our complement manpower workforce from roughly around 10,000 to 13,000. So we will increase by 30%. Currently, PhilHealth is short in manpower on almost all aspects. Kulang po kami ng abogado, kulang po kami ng actuaries, kulang po kami ng HR, ng OP. So we will be increasing that. That's the first. Secondly, again, duly noted on all the points you raised. They are all correct. They are all true. Again, we are working very hard. We are listening to all of you. And we are trying our best to fix all of these in the shortest possible time. And I'd like to think that with the support, again, led by Speaker Martin, and of course, the support of our beloved incumbent President Marcos, in due time, we will be able to move PhilHealth forward and successfully fix all these issues po. Thank you very much po.
Pres Mandy, since you mentioned reorganization, I'm sure, and I'm very sure, that all these efficiencies have allowed some people to take advantage, whether monetarily or by whatsoever reason, to the disadvantage of the agency and the people. Merong kumita dyan, merong nagkapera who took advantage with the inefficiencies that they found, the discretion that it provided. Can you commit to the committee that once you identify who these personalities are, they will have to be, they will have to bear the consequences of their actions?
Mr. Chair, Kong Jude, yes, Your Honor, I can commit that to the committee. And at any point in time, we are more than happy to share the knowledge that we have with regards to this matter, Mr. Chair.
Okay.
Thank you.
Last question, Mr. Chair. President Ledesma, I think this is a question that's on everybody's mind. May sapat na pera ba ang PhilHealth to deliver the services for for at least next year, even without the